Good evening, everybody. Hope you all are doing well. Hope the exam planning is also going well. Okay, so in this session, I'm going to cover delirium as well as neurotransmitters and peripheral neuropathy. Okay, so starting off with delirium. Okay, so according to the latest definition of delirium, it's basically classified as this alteration of attention, consciousness, and cognition with reduced ability to focus, sustain, or shift attention. Okay, and delirium is essentially a disease of the elderly. Okay, now let's focus on an approach to the causes of delirium. Okay, so the D in delirium stands for drugs. Okay, so drugs, under drugs, there are about, sorry, four branches under drugs. Okay, um, okay, so the four branches under drugs, so we have acetal, let me just double check quickly. Yeah, okay. So the anticholinergics. Yeah, so first of all, we have the anticholinergics, okay? And then we have the dopaminergics, okay? Dopaminergics, right? And then we have the opioids, okay? And the fourth one there is alcohol, and especially alcohol straw, okay? The E, there's two branches under the E. Okay, so the first branch under the E is epilepsy. So epilepsy and electrolyte abnormalities. Okay. Um, and the most common type of electrolyte abnormality is that of a hyponatremia. Okay, so thinking of a low sodium, okay, a hyponatremia causing the delirium. Moving on to the L. So the L will be liver failure and low oxygen. Okay, so two branches under L. So liver failure as well as low oxygen. Okay, and in which incidents there's two kind of uh, examples, like for example, in which um, two branches under the low oxygen, and that is that of, for example, patient has an MI, right? Myocardial infarction, okay? And the second one is pulmonary embolism, okay? So perhaps myocardial infarction causing um, perhaps the heart unable to pump blood to the body, so low oxygen supply to the body, and it also or it could be a poor supply to the pulmonary system to receive enough oxygen. And then obviously, the pulmonary embolism. When I think of embolism, I think of blockage. Okay, so again, not getting enough oxygen. The I stands for infection. Okay, and infection is like the causes of like a lot of problems. And then for the R will be retention. Okay, so either urinary or fecal retention. Okay, which can lead to the delirium, and that's why it's so common in the elderly. Next one, we are getting by another eye. So the second eye refers to eye for intracranial, okay? Intracranial. So checking out, okay, what's happening inside the brain what's causing this delirium, okay? So in the brain, two branches under here. We have stroke or a transient ischemic attack. So a stroke or a TIA. And then the second one is that of a TBI, traumatic brain injury, okay, causing an alteration in the um, in the architecture, essentially, basically killing off that the tracks and the nerves and all of that. Okay, traumatic brain injury. The U refers to a uremia. A uremia can go to the brain, increasing that uric acid in the blood, and then aim for metabolic causes. Okay. Now there's quite a lot of there's about one, two, three, four, five branches under metabolic. Okay. Okay. So the first one is that of a low HB. Okay, so we think of low HB, thinking of anemia. Okay. The next one is that of um, low glucose. Okay, so a hypoglycemia. So low HB, low glucose. Okay, a hypoglycemia. A high CO2. Okay, a high CO2. So that would be the hypercapnia. Okay. And then the next one is that of low H2O. Okay, low H2O, and that's present as dehydration. And then endocrine type of conditions. Okay, and the most common one to kind of focus on is that of hypo or hyperthyroidism. Okay, so yeah, so hypo slash hyperthyroidism. Okay, now there was another moving on to investigations, okay, for delirium. So if you kind of understand the causes, it's kind of quite easy to figure out, okay, how are we going to investigate for the delir for the delirium, okay? So someone's entering right up. So looking at drugs, okay, what could we do? We could perhaps do a toxic screen, okay? Let me just use a okay. So over here, in terms of the investigations, okay, a toxic screen to kind of screen for any drugs, okay. Um, and when we take bloods, for example, we should obviously do the sodium, right? Sodium could do drawing the bloods, right? Figuring out sodium content in the blood. Um, with the liver, we can also take bloods and focusing on liver function tests. Okay, the ALT, the AST, and the GGT and the LP. Um, myocardial infarction, your ECG, right? Also for sorry, just right, myocardial infarction and pulmonary embolism. And ECG will definitely help with that. Okay. Okay. Infection. So for infection, we can perhaps do a chest X-ray to look for any pneumonia. Also perhaps on blood taking a white cell count also helps with the infection as well. And also specifically if there is sepsis, okay? If you're concerned of sepsis, well, we'll basically take a blood culture, okay? Then in terms of the stroke or TBI, okay, in that instance, obviously the CT and the MRI kind of helps in that instance, okay. Um, you see, and then obviously with anemia, the HB, okay, with hypoglycemia, the an AGT or glucose test, um, hypercapnia. So a blood gas kind of helps with detecting the CO2 levels. Sort of got uremia, uric acid levels. Okay, uric acid levels, and then you see, yeah, and then for endocrine, obviously we're looking at TSH, thyroid stimulating hormone, as well as your thyroid hormones. Okay, T4. Okay, so and also like with metabolic, another kind of metabolic investigation helpful, that's helpful for the metabolic component is that of getting the B12 as well as folate, detecting the folate levels in the blood as well as thiamine. Okay. Okay. Moving on to just like a basic approach to management for a delirium. So first of all, if there's infection, okay, let me just use a different color quickly. Okay, so if there's infection, we'll obviously give antibiotics. If there's electrolyte abnormalities, we are going to have to correct those electrolyte abnormalities. Okay, um, and sometimes it might not only be sodium; it could be sodium, potassium, and calcium as well. Okay, so sodium, but also keeping in mind checking for the potassium levels as well as the calcium levels. And then let me just see quickly managing the hypoglycemia. Okay, so if patient is very hypoglycemic, um, dextrose. Okay, if it's like very severe, IV dextrose. Um, let me just see quickly. Okay, and then just being specific to the causes, right? For example, myocardial infarction, so we're thinking of the antithrombolytics and also if the patient needs like any surgery as well. Okay, we just see in terms of medication wise, antipsychotics also kind of helps, right? So here we have antipsychotics, right? Antipsychotics, and let me just see quickly. So low dose antipsychotics, for example, haloperidol, or atypical antipsychotics such as risperidone or quetiapine. Okay, so two branches over there, you get your, so for example, haloperidol, okay, and then risperidone, okay, risperidone or quetiapine. And then also your benzodiazepine. So the benzodiazepines is obviously, so the antipsychotic is with for the psychotic type of symptoms, and then the benzodiazepine is essentially basically to kind of calm kind of like hone hone the person down. Okay, I see it more like almost like a calmer, essentially. Okay, benzodiazepine. Cool. So I think I'm gonna stop there for the delirium. I'm gonna move on to the role of neurotransmitters and then discussing the different types of neurotransmitters in the brain. Okay, just seeing over here. Okay, so there are four branches we're going to speak about. So the actual neurotransmitters, so the role of each neurotransmitter, the function of each neurotransmitter, the receptor in which it actually attaches to, and any if something goes wrong, what is the pathology? Okay, that can occur. Okay. Um, let's see quickly. Okay, there we go. So the first one is glutamate. Okay, so just glutamate. Okay, so the role of glutamate is essentially it's a primary excitatory neurotransmitter. Okay, so the role is more excitatory. Okay, the function, so it's involved in synaptic plasticity, learning, and memory. Okay, so synaptic plasticity, learning, and memory. I think this is a bit okay. Okay, and then the receptors that it attaches to is your NMDA, AMPA, and kainate receptors. So it's your NMDA, your AMPA, and kainate receptors. And the things that can possibly go wrong in this case is, for example, if a patient have a stroke or a degenerative disease, um, there could be like an increase in the amounts of like basically there will basically be like a regulation of this neurotransmitters. Okay, so essentially dysregulation from a stroke or a neurodegenerative disease. Okay. Okay, the next one is the GABA receptor. Okay, or the GABA neurotransmitter. So glutamate is more excitatory. So maybe that the E at the end possibly to remember excitatory. The GABA is more the opposite. Okay, so GABA is more inhibitory. So it's basically almost like switch everything like off. Um, so the keyword there is inhibitory, and the main role says it all. So that's the role of function. So it regulates neuronal excitability and prevents overactivity. So the key thing to remember is that it prevents overactivity. So if the glutamate becomes too much, the GABA basically prevents that overexcitability. Okay. And there's two types of GABA receptors, GABA A and GABA B. Okay. So the GABA A receptors, they are more ionotropic. Okay. And the GABA B receptors are met metabotropic. Okay. Metabotropic. And in terms of pathology, right? So GABA receptors are quite implicated in anxiety disorders, epilepsy, and sleep disorders. Okay. Anxiety disorders, epilepsy, and sleep disorders. Okay. For example, if a person is anxious, it's quite uh, di- difficult to kind of like prevent the overactivity. Per patient that has epilepsy, it's difficult for the brain. So again, it's this dysregulation of the GABA receptor, which then, yeah, and the brain just, there's overactivity and those, almost like a, I think of it as almost like a brainstorm, okay? People that can't sleep, right? The GABA receptor is dysfunctional, okay? The next one is acetylcholine, okay? Acetylcholine, just see the spelling quickly, okay? Classical ACH, okay? So the acetylcholine, essentially, the main role is that it's kind of involved in both excitatory and inhibitory functions. Okay. Okay. What is the function? So the function is important for muscle activation. Okay. There are about three functions. Okay. So first of all, muscle activation. Okay. Activating that muscle fiber. So with the neurotransmitters and how it works. So, right, muscle activation, autonomic nervous system functions. Okay, so ANS functions, as well as cognitive processes such as attention and memory. Okay. Okay, the receptors it work on, so it has two types of receptors. You have nicotinic and muscarinic receptors. Okay, so two types of seeds over here. You have your nicotinic, right? Nicotinic is ionotropic, okay? And the muscarinic receptors is metabotropic, okay? In terms of pathology, so deficits of this kind of the acetylcholine is essentially linked to or associated with Alzheimer's disease and myasthenia gravis. Okay, so obviously we know that with Alzheimer's disease, it's a very degenerative disease. Sorry. Okay, so degenerative disease, your neurons are basically dying off essentially. And then also your myasthenia gravis. Okay, uh, myasthenia gravis. Okay, next one is dopamine. Dopamine. Uh, dopamine. Okay, so what is the role of dopamine? So it's a very like key modulator. Dopamine is a really key modulator in reward, motivation, and motor control, right? But it's very important to understand that it's a modulator, right? So it's a modulator in reward, in motivation, okay, and motor control as well. Okay, a patient with Parkinson's disease, for example, has poor motor control, and dopamine is quite low in a patient with Parkinson's disease. Okay, there's a dysregulation of the dopamine. Okay, not enough dopamine is being produced. Okay, in terms of the function, so the function, the role says it all. Oh, I'm running out of time. Okay, it's fine. So the function kind of the role says it all, right? So it's involved in pleasure, right? Pleasure, reinforcement learning, reinforcement learning, as well as movement regulation. Okay. Okay. That's why people with Parkinson's, they kind of, it's really difficult for them too. That's why they have a shuffling gait, for example, tremors, and they can't maintain posture. Okay. What are the receptors? Okay. So it's basically dopamine receptors, right? Dopamine receptors, right? So you get your D1 and D1 like receptors and D2 like receptors, essentially. Okay. D1 like and D2 like receptors. Okay. Just do that. And then, okay, so in terms of pathology, it's extremely the dysregulation is linked to, as I explained, Parkinson's disease as well as schizophrenia. Okay, that's why people with schizophrenia have a very low affect. They have absolutely no interest in anything. Okay, and then also addiction. Okay, next one is serotonin. Okay, so what is the role of serotonin? So it regulates. So try to remember it. I think we can maybe make an acronym. SCAM. Okay. S for sleep. C for cognition. Okay. So sleep, cognition. A for appetite, and M for mood. Okay. But remember, it regulates these things. Okay. So it's you just put at the start the regulation. Okay. So it regulates SCAM. Okay. So it regulates sleep, cognition, appetite, and mood. What is the function of serotonin? So serotonin essentially influences emotional state. So it influences your emotion. Okay. So emotional state regulation influences your emotional state. It's it plays a role in the circadian rhythms. Okay. Now, the circadian rhythms, obviously, like your sleeping pattern, okay? And then, yeah, so those are basically two cardinal functions, okay? And then, obviously, appetite. So, basically, mm, the role kind of speaks to the function as well. And then the receptors are the serotonin receptors, essentially. Okay, so serotonin receptors. And the serotonin receptors are written as, like you get the five, uh, it's like five, then it's like a dash HT. So you get 5-HT1, 5-HT2, 5-HT3, etc. Okay. But yeah, essentially, that's the serotonin receptors. And then what are the pathologies involved? So depression, okay. So people with depression, very low serotonin levels, right? So we speak about depression, right? Speak about anxiety and migraine. Okay. Okay. Next one is norepinephrine. So NE, norepinephrine, and then another term for norepinephrine is noradrenaline. Okay, noradrenaline. Okay, what is the role of noradrenaline or norepinephrine? So it modulates attention, arousal, and stress responses. Okay, attention, arousal, stress response. So AAS, A AAS. Okay, so we have attention, arousal, and stress responses. Okay, so just think. Okay, okay. So the function essentially is that it enhances alertness, energy, and cognitive function. Okay. Um, so if you in a flight response, right? Increase in the norepinephrine, right? Because you need to be more alert in the stress response. You have a lot of energy, and if you're busy with exams, you're in your flight to flight response. Okay, increase it enhances the cognitive function, and then the receptors involved, you get your alpha and your beta adrenergic receptors. Okay, so alpha and adrenergic receptors, and this is important to understand when you do pharmacology next year, Carl. You need to understand all of these neurotransmitters. Kind of helps you a lot. Okay, all of these things are basically repeated in the clinical years. Literally everything. Um, Pathology is dysregulation associated with. So a dysregulation in the norepinephrine is related with mood disorders. So for example, bipolar. Okay, so you have your mood disorders, ADHD, right, as well as, so they're saying here to an extent, hypertension as well. Okay. Okay. Um, and then I just want to mention, like, people, for example, with bipolar, they are very much aroused. They have increased energy, increased alertness. Okay. Um, right though. The next one is histamine. the neurotransmitter histamine. Okay, so the role of histamine is essentially it's involved in wakefulness, appetite control, and immune responses. Okay, wakefulness, appetite control, as well as immune responses. Okay, and the function kind of speaks to the role speaks to the function. Okay, so modulates right, modulates arousal, it modulates energy metabolism, and it also is essential for obviously the immune function. Okay. What are the receptors? So basically the histamine receptors. So H1, H2, H3 receptors. And then pathology involved. So dysregulation is linked to sleep disorders and allergic reactions. Okay. Sleep disorders and allergic reactions. Okay. Let me just see quickly. Neurotransmitters.